Hi, my name is Sarah, and today we will be reviewing the Innominate or Coxal bones for the Bio 231 lab. This photo on the screen is an anterior view of the body, more specifically the pelvis, and the two highlighted bones are the coxal bones, one on the right side and one on the left side of the body, and they do help form the pelvis. Now, the coxal bone has three general areas: the ilium, the ischium, and the pubis, as shown on the screen. And there are a couple things that you need to know about where the coxal bones meet together on the anterior side of the body. First, you need to know the pubic symphysis, which is a piece of cartilage that helps connect the two bones. And then when the two bones are connected, they make the pubic arch, which you can see highlighted on the screen. Now we're looking at the lateral view of the right coxal bone. And this top surface has a small portion known as the ala of ilium. And then to the posterior side, which is this side of the coxal bone, there are two protrusions, and they are known as the posterior superior iliac spine and the posterior inferior iliac spine. Now below the ala of ilium on that surface, there is the body of the ilium. And below all of that, there is the acetabulum, and that's the space that looks like somebody took an ice cream scoop and scooped out a part of the bone. And that's actually going to be the socket portion of the ball and socket hip joint. This is the medial view of the right coxal bone. And on the very top, you have what's that ridge, which is known as the iliac crest. And then, like the protrusions on the posterior side, there are an anterior superior iliac spine and an anterior inferior iliac spine. And the protrusions on the anterior and posterior side get their names in reference to where they are on the coxal bone. On the posterior side, we have the greater sciatic notch, and below that, the lesser sciatic notch. And then we have a hole in the coxal bone, and that is called the obturator foramen. And an odd way of remembering how to say it or what it is on quizzes is if you were to take the coxal bone and it's kind of rounded and you put it to your face like a phone and you were to talk to an operator to talk to your foreman, you're talking into the obturator foramen. It's just an odd way of remembering it. And then going back up to the posterior side of the coxal bone, you have the auricular surface, which is a flattened ridge. This is the anterior view of the right coxal bone. And first you have the iliac fossa. And if we remember, fossa means shallow depression or hollowing. And then going to the pubis, you have the superior ramus of pubis, the body of pubis, and the inferior ramus of pubis. And that's all you need to know for this class. This is the posterior view for the right coxal bone. And now we're going to look more specifically into the ischium. And you only need to know three things, just like the pubis. You need to know the body of the ischium, the ischial tuberosity, which is a rounded out surface, and it's a protrusion, and then, or a prominence, I would say. And then you have the ischial spine, which is a protrusion. Thank you very much for listening and learning with me, and if you have any questions, please talk to your professors, create a study group, and ask your TAs because everybody wants to see you succeed. Thank you very much.